Welcome to Leveraging the Laboratory, a Mayo Clinic Laboratories podcast for administrators, outreach managers, and laboratory professionals to learn how best to leverage and optimize the laboratory for patients, clients, and staff. I'm your host, Jane Hermansen, Outreach Manager at Mayo Clinic Laboratories. Joining me today is a fantastic guest, first time on our podcast, Todd Juen. And Todd is a supervisor within our outpatient phlebotomy department within the Department of Laboratory Medicine and Pathology at Mayo Clinic. And when we think about laboratory outreach, one thing that's tremendously consistent across every lab outreach program is the need to collect blood from outpatients. And we know some outreach programs have customers that draw their own patients, but most outreach programs at some level have some aspect of outpatient specimen collection. And at Mayo Clinic, we have a large outpatient population, as you might imagine. And in Todd's department and some of his peers' departments, we draw over 2,000 outpatients every day across multiple campus locations. So Todd, you're part of that great big machine. Why don't you start by telling us a little about yourself and your role at Mayo Clinic?
Sure. As Jane mentioned, my name is Todd Juen. I started at Mayo Clinic over 25 years ago. I actually started in one of the labs. And then a few years after I started in the lab, I moved into phlebotomy as the assistant supervisor at Hilton-SC. So after about 2 or 3 years, I moved into my current role as a supervisor. And today I oversee the daily operations of Hilton-SC, which is the largest outpatient phlebotomy site in the country. Let's see, on a typical day, we see close to 1,000 patients. About 80% of them are before 11 a.m., all moving through 29 draw rooms. So it's a fast-paced environment, almost like an airport at rush hour is the way we like to think of it. And I really enjoy the challenge of keeping things running smoothly while making sure patients feel supported and cared for.
With a minimal wait time as well, and you do a
Right.
fantastic job. So as a victim of your services myself, I can say you do a great job.
Thank you.
But really, with that huge volume of patients, we can only guess that you are going to encounter patients that have unique and special needs, especially because we have such a complex set of patients at Mayo Clinic. And we know every patient is unique, but there are certain patient types that you have to handle differently in order to meet their needs or provide some very special accommodations. And that's where I want to spend our time talking with you today, Todd, if that's okay.
Sure. Sounds good.
And when we think about it, let's just think about something that everybody has to deal with, the pediatric patient. And when you pick up your labels and you know this is the next patient you're drawing and you see that it's a pediatric patient, what's the first thing that comes to mind? What kind of stuff do you have to plan?
So I think the first thing is we like to think about whether or not that patient's had a blood draw before, if they understand what's about to happen and how we can best approach that situation to ensure a successful and positive experience for not only for the patient, for pediatrics, and also the parents that are with them.
Do you have some dedicated staff that you actually have lined up for them then? Are there some that only draw pediatric patients?
Sure. At Mayo, we actually have a dedicated pediatric space and specifically trained phlebotomists that's their main thing they do. So, yes, we do. And sorry.
So it's very dedicated, that is
yes.
what it is. Do you have patients that come into your main population mix as well at the Desk C area in the Hilton building?
Not for the peds patients. All are scheduled either at, we call it Baldwin, or the Mayo 16 up on pediatric. So
you actually segment them off into a different area?
Yes.
Okay.
Yes.
And in those areas, and you may not be able to tell me, but do you have like a special environment? Is it painted better? Do they have goodies for the kids? How does that work?
So in the pediatric area, there's a dedicated phlebotomist that are up there. That's all they do is peds. The area is all pediatric. So it's what they do is they have it designed so it's similar to the inpatient area. So like as the patients kind of move through the hospital or the clinic, the outpatient area to the hospital, it is familiar to them. And then so that, the most we can do is have them patients comfortable here, so we figure that's a good way to do that. Actually, after every draw, we have what's called it's like a treasure chest or a box that the patients can pick out a toy on it. It's kind of like their highlight of having that blood draw. And the peds area they have these little ducts, and they're all different kinds of ducts. So the patients kind of like going through the ducts to see which ones they don't have yet, if it's the repeat patients, and you see their eyes light up when they find one, especially if they've been here quite a few times. So it definitely takes patience with the pediatric population, and we try to get creative with things that we do for them, make sure we have the right tools, make sure we have child life specialists up there that even sometimes will use music to help with them. So we try to treat them right. So
Absolutely. Well, and a good experience as a child is going to really make their entire care program much easier, and then makes it easier as they're adults when they come to draw their blood as well, right?
right.
So, okay, well, so that's pediatrics, and that's something that just gives everybody a little pause to concern. So we have special people, we have special process, and they get to get their duck collection if they're really lucky. So that's pretty cool. So let's switch to another type of patient, maybe the other end of the spectrum in age. And let's think about the wheelchair bound patient. And of course, I remember back to my days of drawing blood, a phlebotomy chair. There's a nice armrest to stabilize the patient's arm, make it nice and easy. And what we see today, of course, wheelchairs. If a patient is bound in a wheelchair, those wheelchair armrests, they're skinny, they're hard, they're not going to be good for stabilizing the arm. How do you handle a wheelchair bound patient and make sure that you've got the right angle, the right experience for the patient as well as the phlebotomist, and then kind of keep it ergonomic for the staff?
Sure. So for patients in wheelchairs, we use a height adjustable table. The table's similar to what hospital meal tables come, the old meal tables in the hospital, but they're a little bit smaller. And then they can accommodate any kind of wheelchair, whether it's the pushing ones with the high taller ones that are motorized, and also when the patient checks in, we've worked with our desk staff so that they actually indicate on their patient arrival notification that it is a wheelchair patient, so that when my staff they see that on the notification, they will get the table ready before they call the patient, so that the patient kind of feels welcomed and not really I mean, patient feels like we're ready for them when they come into the room.
So they come in, you're not having to move furniture around to accommodate. They're coming into
Yes.
a different area that's actually set and more accessible for them and for the staff.
It's not so much as a different area, it's just we just have it ready for them. It's the same room that a normal patient would be drawn. We find that small details like this just make a big difference. It keeps the process smooth, and also the patients are comfortable when they come in there, because you can draw either arm too, because sometimes certain wheelchair tables or arms, it's hard to adjust for both arms. So we find this works the best for us.
So it's just a standard hospital style table, and you can wheel it up, and it's ergonomic enough for the staff member. So we're not putting ourselves through back pain or anything like that as well.
Yes, it adjusts. They can adjust whatever height they need it, as long as the patient's comfortable. Sure.
Sure. Okay. Well, let's see. I don't know that I have any other questions about wheelchair bound patients, but I think about other patients. And at Mayo Clinic, of course, we have a lot of patients who are international. English may not be their first language, or perhaps you have someone who's got a hearing disability or other types of just barriers in communication. How do you manage that with phlebotomists and manage that communication with our patients?
So first off, yeah, we serve a large, diverse patient population here, especially in my area. A lot of patients travel from all over the world to us. Sometimes the patient will have a Mayo interpreter with them, but that's usually not the case. So for us, for patients who are deaf or hard of hearing or don't speak English, we use an iPad. It's an iPad-based program, a translator-based program. It's mounted on a pole, so we can take it to whatever room we want to. Basically, the phlebotomist will connect to a live person, and whether it's either sign language or whatever language that patient speaks, and that kind of removes the stress of kind of guessing or relying on gestures, especially with hard of hearing. People think you can just, and a lot of times patients don't know what it means, what you're trying to talk to them with, so, and it helps, especially the hard of hearing, makes them, help them feel understood and that we really cared for them by getting somebody that can actually do sign language for them.
Sure, sure. That's fantastic. So are these translators all mostly on staff at Mayo? Or do you have
No,
extra
these are
full-time?
actually, it's a program that Mayo has a contract with. So it's available, I think, to anybody or any institution. It's, I forget how many languages are on there. And, because there's so many different dialects, especially like in the African countries and that they have all that on this translator. So it is not a Mayo-based
Oh,
translator.
wow.
Yeah.
Okay.
Yeah.
So then does the phlebotomist, do they speak into it and then
Mm.
it translates? They're not having to type anything, right?
No, it's actually a person. So ours is a
Oh, it
person.
is.
So yeah, we're talking to a person. It's not like translate what they say. So like, and then when for the sign language, a person's on there and will actually sign what we do. So yeah, you're actually speaking to a person. It isn't translating it into their language. So
Oh, that's fantastic. I didn't know
yeah.
about that. Learn
And
something today.
by doing that too, if the patient has a question, because we do a lot of container handouts, so that's explaining to a patient
Mhm.
how to go into that container or what kind of diet to do. You couldn't. It'd be hard if they couldn't ask questions. So what they'll do is usually they'll ask the translator, and then the translator will ask my staff. This is what they're wanting to know, and it's a pretty smooth process.
Oh, that's fantastic. Well, and now you're getting that two-way communication. You don't have a lag or anything like that.
Yeah, because like even some people try to use like Google Translate and that, and it just slows that process down. It
Mhm.
doesn't feel the same as being able to ask the question personally and then just having a person kind of talking to them and explaining what we're explaining to them. So
Oh, that's fantastic. Well, and you mentioned a lot of international people come in. We know some of them might be world leaders and some of them might be what we would consider VIPs. And
Mhm.
it's funny because we're used to it because we serve a lot of diverse
Mhm.
people from around the world. But a lot of the outreach programs across the country, same thing, whether
Mhm.
it's a professional athlete or maybe it's a politician or even a leader within the health system or a famous person. And there are reasons that they probably don't want that person to be sitting in the waiting room with other patients.
Mhm.
That person may not want to just for security or privacy reasons. Whether it's a VIP, an athlete, a politician, or anybody, how do what kinds of thoughts do you have about the best way to handle those types of patients?
So I'll kind of tell you how we do it here. So, in addition to supervising Hilton Desi, I also oversee what's called executive health. So what that is, it's kind of an exclusive clinic area that serves patients whose corporations can sign a contract with Mayo to have their employees be seen there. We do all their labs up there. They see their physician. So what we also use that space for is for those VIP patients. So what we do is one of their staff will contact me or my assistant and kind of arrange ahead of time that we would go to that person's room to be drawn, to draw that patient. So that, we maintain that privacy, the security, that's the number one focus with that, because if they were going to wait in the busy area like Desk C, that's that's not going to work too well. Even if they tried to come in like a side door at Desk C, there's just so many, we see so many patients down here, so many patients walking the hall, it wouldn't work as well. So one of my staff members, they'll go to that private room, where the doctor's in there usually too. The patients then can have everything done there. They don't have to keep walking in the campus. It's discreet, it's respectful, and allows these patients to receive that same high quality of care, just in a more private setting. At the end of the day, every patient is important. For VIPs, we adapt our approach to meet their individual needs while ensuring the experience, is smooth, safe, and comfortable for them, so that, they want to return and speak highly of us.
Right, right. Well, and just I think the disruption for the regular population of patients too, to have this
Mhm.
person in the room, certainly distracting. So I think that to allow them that good experience is helpful. And that's something that I really wasn't aware of how it was handled. I knew we had people
Mhm.
that, but I've never
Yeah,
seen them out in the waiting room. So I
yeah,
knew
yeah.
something had special had to be going on, Todd.
It depends on the person. Sometimes they'll have male security with them, depending
Mhm.
on who they are, they'll have their own security. So it's just more private, and they have different elevators they take then, so they're not on the same elevators. So
Sure, sure, absolutely. And I can just tell you, I've walked down the hallways and I've just seen famous people as well. So
hmm
sometimes and maybe their star is fading a little bit, so that they're more comfortable being out there as well.
and we've also had patients that they insist on just coming in, and going
Mhm.
through our area, and it's like, you see them sitting out there, and they are somewhat famous, but that's just how they want to be too. So
Sure,
we
sure,
respect that
absolutely,
too.
absolutely. All right. Well, Todd, I think I've learned a little bit.
Mhm.
We've talked about the pediatric patients. We've talked about those who are in wheelchairs. We've talked about those that maybe we have some barriers, and of course the VIPs. And I, if you've paid attention to this podcast, what you'll know is that I tend to close every podcast with a rapid fire question for the guests. So you're on the hot seat, but this is probably pretty simple. And I just picked out of random 4 different types of unique patients, and I've probably oversimplified that, right? What
Mhm.
else do you think our audience should know about when you're serving a very diverse and complex outpatient market and these outpatients? What do you want our audience to know about?
Well, I think one thing, phlebotomy sometimes may seem routine, but there are new technologies that are coming on the horizon. For example, there's a autonomous blood collection device. It's already approved for and used in Europe, but it hasn't reached the US yet, but in time that's going to provide like another option for patients to have a consistent and efficient blood collection. Even in these areas like phlebotomy where you think nothing new ever happens, there is innovations coming, and we just have to kind of be patient a little bit, but there's definitely things coming on the horizon. So that'll help improve kind of the staffing shortages sometimes, and patient experiences.
Well, and to have a robot drawing your blood, right?
Yeah, right. Exactly.
It's kind of like back to the Jetsons, the old cartoon. But when you think about it, it reduces variation perhaps. It
hmm
might provide a more consistent experience, certainly helping with staffing, like you said, and perhaps even maybe even having more success with people who are
hmm
difficult draws. But
Right.
you'll have a new set of challenges, I would guess, if you go with that, then more explaining to patients what to expect because this is new, right?
Yeah, exactly. Exactly. There's a need still for phlebotomists. It's not going to replace people's jobs because it's not going to be able to communicate with that patient. They're not going to know, hey, this is the spot to go. It's going to pick its own spot. So I think there's still a need for phlebotomists out there, even if this does come into areas, and it's not like it's a cheap product. It's more for adding to the phlebotomist role than it is taking away to the phlebotomist role. Um, does that answer the questions?
That sounds pretty good. No, so
Mm,
from my perspective, I had to draw blood as when I was a hospital-based laboratory
mm,
technologist, and boy, it was the most important thing. Had to get it right, and
mhm.
it wasn't always easy. So we admire and appreciate all of the work that you do, that your team does, and all the work that you do to make it a good experience for the patient. So Todd, thank you for your time and talking with us
Sure.
today, and especially related to meeting those unique patient needs in that outpatient phlebotomy experience. And what you do makes a huge difference for our patients. So thanks for what you do.
You're
And
welcome. Thank you. Mm.
thank you for listening to Leveraging the Laboratory, a podcast from Mayo Clinic Laboratories. If you've enjoyed this podcast, please subscribe. Until next time, we encourage you to continue to promote your community-based hospital laboratory. The needs of the patient come first.